Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzi. And as always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, it is my very great pleasure to welcome Tatiana Fayne. Tatiana comes out to us out of Michigan, USA. She says she's a mother of two beautiful children who are her greatest accomplishments. She's a passionate advocate for women's health and education. She's looking to own and operate a burning birthing collaborative one day in the near future. And she says she'll be embarking on obtaining her doctorate of nursing practice, certified nurse midwifery degree at the University of Michigan. So, welcome, Tatiana.
Thank you. Thank you.
So my first question always is why? So why are you a nurse? What brought you here?
I never wanted to be a nurse, ironically. I was in education first.
Hmm.
I never even thought about it, but someone made me angry in education, and I decided to see what it was like in the medical field. So I went to school to become a medical assistant. It was a 6-month course. I had a friend who was taking a course at this school because I'm from Cleveland, Ohio. So she
Mm.
was taking a course to become a pharmacy tech. And I said, well, what else do they have at that school? And she told me all the things. And I said, well, I think I'm going to take the medical assistant course. It was a 6-month accelerated course, and I fell in love. Like I literally went. Everything for science lit up for me. I'd never liked science in high school. I was really, really good at it, but I did not like it because it was too much to remember. It was so tedious, and you had to remember all the pieces and parts. And I was like, I never wanted to do anything. So I did. I fell in love. Well, 6 months into becoming a medical assistant, my mom was rushed to the hospital, well, sent to the hospital by me and was experiencing angioedema from lisinopril, a medication that she had been taking for years. And then all of a sudden, she was allergic. So she spent over 30 days in the ICU at Cleveland Clinic. And I didn't like how I was being treated as a family member. And I said, I'm going to be a nurse. I'm going to change this from the inside out. And that's what lit the spark. It was my mom.
Aye, that's quite a story.
Yeah,
So you came to this role as a second career, and it's another career of service.
it is.
So what challenged you coming into nursing?
What challenged me? Everything about nursing challenged me because you have to deal with people. And education becomes very daunting because the kids, you can get them on board, but if the parents aren't, then that's the problem. And for
Yeah.
me, it's always been easy with kids. Like they listen to me, they understand, they have no problem. With parents in education, you get mostly two types of parents. Those that don't care at all,
Uh-huh.
and then the helicopter parents, the ones who are just all over the kid and they're on your nerves and on the kid's nerves. So in nursing, my challenge was figuring out how to educate without making people feel small.
Yeah.
Because I know in the Black community, a lot of people, especially when it comes to their health, they don't like to say that they don't know. They don't ask a lot of questions. So then there's a lot of gray area. Um, and so just finding that balance, because mostly, I mean, I am in the ER, so I deal with adults. Um, and finding a way in, I think, is always a challenge. So I try to find one little thing that is alike in our lives when I'm talking to my patients, and I use that as my segue. So
Hmm.
just getting people to trust you is the
Yeah.
biggest thing. Yeah,
Yeah. It is a big deal. It is a big deal.
yeah.
And it comes at a time when very often you're again you're in the ER. People are raw, they're nervous, they are vulnerable, all of those kinds of things. And you know, you walk up maybe looking self-assured and they're like, I don't know.
Yeah, but see, and I get that. However, I think that, well, I know that 99%, I want to say 100% of my patients think that I'm 20 something years old.
Yes.
So I have that conversation more often than anything. Oh,
Hmm.
how long you been doing this? Oh, what is this? Oh, and then when I tell them, they're like, you can't be. It's impossible.
Yes.
And I like, well, no, it's possible. My kid is 23. So I can tell you for a fact that I am not 23. Um, but then I feel like that makes them feel a little bit better. But I found myself even yesterday I had a patient who was on lisinopril and had some swelling, and it started for her. And so I talked to her and I told her, listen, this is something that happened to my mom. It didn't, and I think that it probably happened in the same stages to my mom that it happened to her. But my mom had been at home all day and had done nothing about the irritation and swelling in her throat and her mouth that she was feeling until I
Yeah.
showed up.
Uh-huh.
Okay. Then I explained that to my patient. And the doctor walked in and we're both talking to her. And she said, so am I not supposed to take a blood pressure medicine? And he said, well, you're on amlodipine too. And she goes, oh, that's for blood pressure? That's my N. So as soon as the doctor left, I said, listen, it's your responsibility to know everything you take
No.
and why. I said, so this is your doorway in. Now, when you go to your next appointment and we want you to be seen and then, or at least try to be seen the next couple days, let them know what's going on. I want you to ask for a list and I want you to take that list and write down why, the why to every medication that's on this list so that you know exactly why you're taking it and you can give this information to your kids because she told me, oh, I wasn't going to come in. My daughter told me, and I said, listen, every time whenever you're experiencing something that you don't normally experience from anything, go get a seat
Hmm.
about it.
Yeah.
On it. Yeah.
Yeah. Yeah. Yeah. And that that thing about not knowing what we're taking
Hmm.
um is such a huge thing for us as nurses. It's such a huge hurdle to climb because so often we come across people who just take stuff because the
The
doctor
doctor
said so.
said, right, right.
But
And
why
so
are you taking it?
education for me is big. That is my favorite part of nursing. And
Hmm.
so every time, like I said, somebody could have made her feel stupid about like, well, how do you not know what you're taking? And that shuts the door instead
That's
of
yeah,
opening it and making
yeah.
her want to learn more. And so I use every opportunity to actually meet them where they are and
Hmm.
then try to build it from there.
Yeah, absolutely, absolutely. What do you think you would like to see change about nursing, if anything?
I would like to see a lot of things change about nursing. I would like to
Okay.
see, because we talk about this idea of patient included care, but how included are the patients really at every turn? Um, I want to see that mentality of nurses eating their young. I want that to die as soon as it possibly can, because I experienced some of that in nursing school. But again, like I said, people think I'm young. And so I spend a lot of time educating everyone, um, not just my patients, but teaching people how to treat me
Hmm.
and therefore treating everyone. Because just because I'm a new nurse, or even if it is because you think I'm 20 years old, I'm not in here because I feel like I know more than you. I may know more than you about a certain thing, but you may know more than me about something else. But we have to see what it is we know, period, not
Yeah.
know more or less in
Yeah.
order to make it better. So, um, those are just a few of the things. But I want nurses to, um, as serious as I think we take ourselves, sometimes I think we take ourselves too serious in the way of sometimes gatekeeping certain things and not just making it a way for everyone to, I mean, patients are never going to be nurses. They haven't trained for it, but they can be better equipped to handle things.
Yeah.
I don't like the fact that when people come to the ER for things that are not emergent, that we can't say that. That I used to take my time to tell young people who came in for STD testing, you need a primary. You need someone who knows you. You need someone that you can talk to about these things. You need someone who understands if you have asthma, what
Mm-hmm.
your exacerbations look like. Because when you come to the emergency room, we are trying to get you stable.
Yeah.
That's all we do. We
Yep.
get you stable to somewhere else. But you need to know what your baseline is in order to know how to help yourself before you get to this point, or just help yourself, period. So I just think that as nurses, because we do most of the job anyway,
Mm-hmm.
that we could do a better job at the education part and not being so frustrated with each other and with others about what they do and don't know.
Awesome, awesome, awesome. As you talked about nurses not eating their young, and you want to see this that thing change. I will
Yes.
tell you that there is a nurse, and I've been telling everyone there is a nurse. Her name is Teresa Sanderson, and I hope she does not mind me saying it. But Teresa Sanderson has started this movement
Mm.
called Nurses Feed Their Young because
Like it.
absolutely, absolutely. I think that is one of the greatest things I have heard in a long, 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 long time, and it's a
Yes.
movement that she's working very assiduously at. So
I like it.
you said that you want to open um a birthing collaborative. You want to be a
Mhm.
midwife.
Yes.
What drew you into that space? What is it about that draws you?
So another thing I happened into was female pelvic medicine and reconstructive surgery. I
Okay.
had the great opportunity to be relocated to Texas as a medical assistant with a surgeon that I worked with in Cleveland, Ohio, and helped her to start and build her practice. Women's health is just so beautiful to me. The things that we endure that no
Mhm.
one knows about, the things that we don't know about ourselves
Yeah.
that we
Hmm.
need to be acquainted with. So being in female pelvic medicine, I learned what prolapse was, what a pessary is, all the things that can be done appropriately for it, how normal surgeons, not in any who don't have the FACOG training,
That
how they're monopolizing on women. They're doing them a great disservice for
mhm,
the
mhm.
surgeries, and then they have to have them redone. I've learned about stress on your pelvic floor. So, and in her practice, I did um, anal rectal manometry. I did pelvic floor rehab, and what's my last one? Bladder testing is what
Yeah.
you would call it in layman's terms.
Mhm.
But all of those things just kind of solidified that women need more. We need more understanding, we need more education, we need all those things. So I had been a doula. I'm not certified yet, working on that too.
Mhm.
Um, but taking this doula certification course by Miss Robin Wise, I realized what a deficit there are for Black midwives. What we need as Black women
Mhm.
to actually just make it through childbirth, us and the babies. And I was just like, okay, okay, God, I think this is what you're asking me to do. It was something I felt. And initially, I wasn't going to the University of Michigan. I wanted to go to Ohio State. Ohio State had a dual specialty program with women's health and certified nurse midwifery.
Mm-hmm.
But when I reached out to them in October of 2023, I was told that specialty was being disbanded. They were taking it apart, they were redoing curriculum, and it would no longer fit to be one program.
Mm-hmm.
And so then I got on US News World Report and saw that Michigan was the number 2 in the country, Vanderbilt was number 1, and I just didn't want to move to Tennessee. And so I was just like, I'm
There you
going.
are.
There was my answer. But I just think that, especially for Black women, we need birthing support. We need birthing education. We need sexual health education. We need just education about who we are, what makes us, the things that our bodies do after having these babies, the things that our bodies do before having these babies, what the best choices for us are, how to take better care of ourselves, just all of the things.
The
Because I think
whole.
back to, yes,
Mm-hmm.
when I think back to my mom was in her 50s when she had this angioedema happen. That's really, really young.
Young. Mm-hmm.
That's extremely young. And I think I never saw my mom exercise. I've never seen her run or walk or do any of these things. And I feel like, I don't know like if it was for her entire generation, but I know that for her and her siblings, I never saw them do any of those things. So that's kind of lacking. The education there is lacking about how to keep yourself fit, how to maintain your diet, because she has all these comorbidities, hypertension, high cholesterol, diabetes,
Mm-hmm. Mm-hmm. Mm-hmm.
all these things, but just how to take care of yourself so they maybe don't exist.
Yeah.
So I just see a gap that I want to stand in and just kind of stretch my arms out so then everybody else can stretch theirs and we just close it eventually.
I get you. I get you because I see those same things. I see those same things. And it is unfortunate that that education gap exists.
Hmm.
And maybe I'm putting it mildly to say it's unfortunate, but we really do need to make this the last generation that is
Yes.
so uninformed.
Yes. Yes. And there is so much information at, I guess, my generation's fingertip. I don't use a lot of it, TikTok and all those things. But with information being so close, we have to do better. And having so much information, we need good information
There
to
you
be
go.
available. We need
Hmm.
appropriate, accurate information, not from someone's cousin, sister's uncle who thinks they know. Well, who may know by way of many things, but we need really, really good, rich information.
Yeah, yeah. And how to access it. Because a lot of people
Mhm.
in that I said in that, I mean in this generation, may very well be aware of the shortfall, but are not quite
Mhm.
sure how to access it.
Yes, yes.
Yeah, yeah. So I was going to ask you about the barriers that your patient face, but you just mentioned quite a few of them, and one of them is lack of education.
Education, I feel like whenever there's an issue, it always leans back to education. There is no way, being fully informed, you can say, I don't know.
Yeah, yeah, yeah. And a lot of people also are very proud,
Hmm.
um, very reserved, very private, um, in the way that they look and deal with their bodies, and somehow feel that an illness is a poor reflection on them,
Hmm.
and it was their fault. Which, sometimes we can do better than we do, but
Hmm.
we have misconceptions sometimes about how or why we are ill. And
Yes.
so communicating that to someone sometimes it feels like um, almost like a condemnation,
Hmm.
you know. So that's another thing I see. I see that people are very reluctant sometimes to be fully open about what's going on.
Yes. I think fear is also a
Hmm.
thing. If I don't know, then it can't get any worse than this, which is obviously not true. But people kind of live there. Like,
Yeah,
okay, I
yeah,
just
yeah,
know just enough. If I don't, if we don't go too far in this, yeah. But education is always the key. It is the catalyst for everything, either
yeah.
way, good or
Either
bad.
way,
So
either way, either way. Yeah. So coming to nursing as a second career, and I can see just from talking to you that you're totally in love with it. But what advice would you give to someone who wants to be a nurse?
you have to love it. I come across a lot of young women that I think that they believe that nursing is pretty, or it's one of those things that you can just do because it is a notable career to have. But there has to be a love for something in nursing, whether it's a
Hmm.
love for people or a love for education. Um, because if not, someone is going to get a hold of you and chew you up and spit you out. I don't know if it's going to be a patient. I don't know if it's going to be a peer. I don't know who it's going to be, but someone will make you rethink all the things you thought if you not do this for a reason, and it cannot be the money because yes, nursing pays more than education or being a teacher, but you're not making billions and billions of dollars as a
No,
floor
you're not.
nurse
No, you're
or
not.
like you got to work for every dollar you get, you best believe. And to never stop asking questions. You never can know everything. Always, always, always ask as many questions as you can think of, ask as many questions as you want, and be okay with not knowing.
You have to be, especially as healthcare is evolving so quickly.
Hmm.
Keeping up, you're on a treadmill. So
Hmm.
not knowing is not it's not a detriment, really.
No.
It's a matter of availing yourself of the knowledge. As you said, asking. Asking.
Mhm. Asking.
Yeah. Yeah. So I have one more question.
Yes.
Or maybe it's two.
Okay.
It's one with two parts. Um, first of all, is what does self-care mean to you? And what do you do to take care of you?
Ooh, self-care means everything to me. I learned that. My children's grandmother told me, I don't even remember how old they were, but they were young,
Mhm.
that you can't take care of everyone else if you don't take care of you first. So it's back to the mentality of someone I heard, like you can't fill another bucket from an empty bucket.
Uh-huh.
So self-care means absolutely everything to me. And sometimes it means nothing, doing nothing.
Mm-hmm.
Sometimes it means sitting on my couch and not moving all day because that's what my body is telling me.
Mm-hmm.
Some days it means getting out in the sunshine, walking and running. Some days it means watching my favorite episodes of shows over and over again. Sometimes it means mani-pedi, getting my hair done, doing all the things. Sometimes it just means having ice cream for dinner because that's what I feel like. I just do whatever I want for self-care. For whatever the day tells me that I need, that's what I do.
Mm-hmm. Yep. Yep.
Yeah.
Yeah. Absolutely, absolutely. And I ask that question of everyone because I believe or I see it that especially as nurses, and especially as female nurses and as
Hmm.
mothers and whatever, we tend to put ourselves so far back on the burn.
Back.
In fact, we're not even on the stove,
No.
you know? And I think that we need to really stop and ask ourselves, what does it mean? Because it's not the same for everyone.
Hmm.
It's not even the same as you just pointed out for you 3 days in a row,
No.
right? And you have to be willing to take care of you. Understand that if you fall over, you can't take care of anyone else.
Work will replace you.
Work will replace
Quite
you.
frankly, that's all they're gonna do. They're not gonna
Yes.
hold a memorial. They're not gonna leave your desk the same. Work will replace you. Your family, they will mourn you, but they don't get you back, so there's nothing they can
So
do about
yeah, they have to move on.
it. Right. So you got to take care of you. You before you can take care of anyone else. It's like the airplane. You have to
Yeah,
put your mask on first before you can put anybody else's
yeah.
on. So
And
yeah.
it's our responsibility. It really
Hmm.
is. It really is.
Hmm.
And one of the things that I really want us to stop doing, like right now, just stop it, is accepting things for ourselves that we would never accept for our patients.
Hmm.
We would
Or
never
for anyone,
accept,
we stand up and fight for everybody but us.
yeah, you know, um, our patient, we go in and our patient hasn't passed urine in 5, 6 hours, and we're like, well, what's going on? And yet we think it's okay to go for a whole 12-hour shift.
I don't. I
You
drink,
know,
I eat. I'm taking all my breaks. I want it all because that is what I'm working
exactly,
for. Yeah.
exactly, exactly. And that is what I really want us all to do because, we're not robots. You're not robots. And we talk about very often the emotional toll that this job can take on us. But sometimes the emotional toll is magnified because our physical self
Mm-hmm.
is so deficient.
So broken down. Yes, I agree.
Anyway, I'm gonna get off that soapbox.
Oh,
Because I could go on that soapbox for a while because it
mm-hmm.
bothers me that we don't
Yeah.
and I have to say that I have been guilty. It's not that I've been perfect at this. I
No,
am
yeah.
still a work in progress when it comes to that. But
And I
I've been
think
guilty.
we kind of get conditioned into it. And
Mm-hmm.
we just fall in line with what everybody else is doing.
Mm-hmm.
So you didn't get a lunch. I don't take one either. Like we
Yeah.
just kind of, and it's just
Yeah.
been something that's been there. So we just
Yeah.
all kind of just get in line and follow it and get in line and
Yeah, and,
follow it.
and and we have not for nothing. You just mentioned that, but now we do have this thing of disapproving. We can look
Mhm.
disapprovingly on someone who
Mhm.
takes the break that they're entitled to.
Yes. I remember doing that to someone. It was a man though. I mean, not that that made it better, but I was just like, oh, so you're gonna be the only one to take a break? Really, sir? Yeah.
Yeah, we do. Yeah, we do.
Yeah,
Tatiana,
I
this has been a
did.
great conversation. I have loved it. Any last words you want to leave us with?
Let's do better together. Let's do better together on all fronts. Being
Yeah.
kinder to one another as a people, um, making sure that our patients feel fully supported and educated, and also advocating for ourselves.
Yeah. I can get behind that. Thank you so very much for that.
You're very welcome.
Thanks, Tatiana. Have a good one.
You too.